My name is Andy Dunn. I'm a primary care provider, chief of staff at the hospital, Wyoming Medical Center, chief of primary care, and then active board member of Natrona County Public Health. I've been working with Natrona County Public Health in a partnership in the outpatient setting since March 2020 with our task against COVID. As a provider, I've seen several different stages of COVID. I think it started in the spring where we didn't know what to expect. We saw the news in New York and Italy and Phoenix and Houston, and it never really happened that way here. And we're not complaining. The spring was good to us. It was a time that we could figure out how to epidemiologically trace things, contact trace things, understand prevalence, the positivity rate, work on mitigation, isolation to control this virus. Then the summer came, and I thought we were going to have a lull. I was wrong. We didn't have a lull. Late June, early July, we started to see numbers increase, both in the outpatient setting and inpatient setting. That steadily became worse, more progressive through September. And about 2-3 weeks ago, I woke up to a text that had a condition orange on my phone. And this is from the hospital. I've been here 11 years, and we've had that one other time, and that was a bus accident on I-25. That was probably 9 years ago. And basically, that's a condition of all hands on deck, too many patients, not enough help. And again, first time outside of the bus accident in the last 10, 11 years. From that point on, we have doubled, tripled our inpatient census. Today, we're at 39 patients in the hospital with COVID. That's a stark difference from the 3 to 4 that we had during the summer. The outpatient setting, positivity rate is too high. It seems like almost everyone knows someone that has it, whether it's a family member or a good friend, not an acquaintance, but someone that's close to them. As a primary care provider, I see patients in nursing homes, assisted livings, the respiratory symptom screening clinic, and as well in the hospital. I think the first real devastating look I had at the ramifications of COVID occurred at a nursing home when I was rounding 8 days ago. I do want to say that the staff of the nursing homes are doing the best they can. They're doing a good job. This is a horrible process, highly contagious, and so people have to basically wear a beekeeper suit, for lack of a better way of saying it, to keep it away from them. But it's a process to get in and out of rooms. So they're working extremely hard with the patients. But what I saw were patients who had progressed through the illness to the point where they were put on comfort care. Comfort care is a way to say that we're not going to get better, and what can we do to help the last moments, last hours, last days of your life to be comfortable. And I saw about 5 patients in one setting, one facility that were on comfort care. I saw the staff do everything that they were trained to do, but I saw patients that didn't appear comfortable. When you have this virus, you can't have people around you. You can't have your loved ones around you. It's a hard way to go. I put a blanket on a patient. I put oxygen back on a patient, a couple of them, because they were restless and the oxygen had fallen off. But that it stuck with me. Well, that's all I could do at that moment. Just pull a blanket up on one patient and put the oxygen back on several other patients. As a doctor, you're trained to do the best you can and help as many people as you can. And I couldn't do anything. I tried to comfort the nurses. They're doing the best they can, and they're trained to do the same thing. And the wear and the stress on their faces, something that I always take with me. I've been a hospitalist, I've been outpatient provider, I've done pre-hospital work. I've never seen staff members as emotionally drained and as physically exhausted. 16, 18-hour shifts when they should have been 12 hours. A lot of good things are going on at those places where we have our most special population of patients, the highest risk of patients for mortality with this virus. they're doing the best they can, and unfortunately, there's not much we can do. And when the staff gets sick with COVID, they can't come in, and so that's one less hand to hold a patient, one less person to pull a blanket up or put oxygen on those patients. Everywhere's experiencing staff shortage from COVID, whether they got in the community, or maybe they were quarantined because one of their immediate family members has COVID. But when you can't do what you're trained to do to go in to help because you yourself are sick, then it's a really harsh domino effect. And that's been something I'm still trying to grapple with, as most people are that experience this in the nursing homes and assisted living. I think a lot of us are having a hard time processing things. There's one case. It was 2:30 on a Sunday morning. A patient was actively dying in front of me at the hospital with COVID. And her husband of 50 plus years wanted to say goodbye. But he can't come into the room. He doesn't have COVID. She does. If he got COVID, then that would mean detrimental, potentially mortality issues for him. So at 2:30 in the morning, I found myself FaceTiming him with his wife, holding the phone. She wasn't awake at that time, but I always believe that patients can hear you, can hear your loved ones. It's a very intimate moment, and he was able to cry with her and tell her that he loved her. That's love. That was a great example of love, and I understand his frustrations and the family's frustrations. I can't imagine that. That was a hard moment. There was another provider with me in the room, and he was holding the patient's hand and rubbing her shoulder. And she passed about 10 minutes after that call. When you walk through the hospital, it's not like it's ever been before. Like I said, I've been a hospitalist. Things aren't, it's just different. You walk in and you see gowns and you see places to disinfect yourself and make sure you're not passing to other people. It's something I've never seen before. I don't recognize the hospital right now because of everything that's in the halls to trying to accommodate the patients that do have COVID inside the rooms that we're trying to keep separate from everyone else. While we still have the patients who unfortunately have the heart attacks or the strokes or the accidents that need hospitalization. I think everyone hates COVID. I hate COVID. COVID has meant sacrifice for everyone in the community, healthcare professionals included, staff included, but something that we've been called to do to help people and to do the best we can for people. And I would just implore you all to help us and support each other, love each other, give each other grace. With that, give each other distance. Put a mask on. It doesn't stop it. It won't stop it. But it does affect how far the water droplets and the aerosol-wise particles are expelled on exhalation, coughing, sneezing. So instead of projecting droplets 8, 9 feet, 6, 8, 9 feet, maybe you expel the droplets 1 or 2 feet. So you save that person at Walmart that's 4 or 5 feet away from you. Because there's a big percentage of folks that don't have symptoms that have COVID, asymptomatic COVID patients, and that are actively shedding the virus every time they laugh, every time they talk, every time they cough, sneeze, and they don't even know they have it. So please help us to continue to take care of patients at the nursing homes, assisted livings, the outpatient clinics, the hospital. And I would just ask the community to give each other grace, love, and support and understanding. I understand the frustration, the felt frustration's palpable. I just encourage open communication, open dialogue, research, and truly, we're in the same community. We're trying to do the same things. We're trying to help each other. So let's just do this together.